Hi everybody, thank you so much for joining me today and welcome to your Pilates session. Well done on showing up and committing to moving and looking after your body. Today's class will use a magic circle. So if you have one, you can grab it now. If you don't have one, don't worry, you will still be able to participate in the class and do everything that I instruct, as I will be offering modifications to do it without the magic circle. So to begin, just find a comfortable seated spot. I'm going to stay here with my legs crossed. Take your hands to your ribs, breathe in, and exhale. Continue breathing in and breathing out. And just take these first few minutes to allow yourself to feel that breath. Let it show up in your body. And get really familiar with how it feels to completely fill your lungs. Feel how your ribs expand to the front and to the sides and to the back. And then as you exhale, feel how they draw together. It might feel uncomfortable at first, but that's okay. We work through discomfort. And in Pilates, there's a lot of times when you hit that crossroads of finding out if it's uncomfortable because you're not used to it and it's new, or if it's painful. And I invite you to get really curious about that. Don't be afraid to go into the depths of discomfort. Now, as you exhale, start to engage from your core. So exhaling, drawing your ribs in, pelvic floor lifts, belly button comes in, narrowing at your waist. You can be hands-on with your body here, so feel on your exhale how your waist comes in, still finding length through your spine, like you're being pulled out by the crown of your head. 2 more complete integrated breaths here. Relax your shoulders, relax your face. You can smile. You can just let yourself be here and let everything else go away. Now pick up your circle. Take your palms on either side. And we're going to integrate the breath and the core with the circle. So inhale to prepare. And then on your exhale, pressing the circle in and release. Now we're slowly starting to build up the layers here. So the challenge of this is that I want you to press the circle in while still feeling that activation from your center and the work from your core, and connecting to your ribs and your breath. So it should almost feel like everything is happening in sync. So the circle coming in is the same as your waist narrowing. The circle handles is the same as your ribs coming together. Go deep inside yourself. Find the completeness of your breath. Be mindful that your shoulders aren't elevating for this. There's a sense of them coming in and down the back, along your spine. If this feels like strong work on your arms, good, it is. One more here. And then flip the circle so that it is parallel to the floor. Change the orientation of your hands so that your fingers point forward. Same thing, inhale to prepare, exhale, pressing in. Now you might find this is a little bit more challenging. And I encourage you to really go back to finding the work from behind. So as you exhale, ribs come together, shoulder blades come together. Strong core work from your center. Continue on, staying connected. 3 more here. Last 2. Last 1. Now just take the circle over to one side and have it sitting on your rib here. Have your other hand on your other rib. Feel how you inhale. Ribs expand. Exhale. Press into the circle. Inhale, release. Exhale. Press in. Now you're starting to use the circle now to help facilitate your ribs coming together. Still staying connected to your core. Feel the pressure on the side of your rib, pressing them in like you're trying to knit your halves together. 2 more here. And then switching over other side. Inhale to prepare, feel the expansion. Exhale, drawing in, pressing in. Inhale. Keep checking in, do that scan, feel your pelvic floor lifting, waist narrowing, and then on the counter, ribs expanding as the circle releases. 2 more here. Excellent job. Just place the circle to the side. Bring yourself around. And take a second and you can just press back into your child's pose. Let yourself release any tension you may have started experiencing in your upper back or your lower back. Sometimes when we sit for a long period of time, that can appear. And then bring yourself to your 4-point kneeling. So knees line up underneath your hips, palms line up underneath your shoulders, lengthening out through the crown of your head to the tip of your tailbone. And then just tuck your tailbone underneath. Draw your belly up, rounding up through your cat stretch. Inhaling as you reverse. Exhale. Find that roundedness in your spine, drawing your belly up, tucking your tailbone underneath. Really trying to get that pulling up sensation. Inhale, driving through. Now if it feels too much for you at this stage to come through extension on the inhale, then feel free to just come back to a neutral spine. Exhale, tucking your tailbone underneath. Feel your palms press in like you're trying to launch yourself off the mat. One more set here. Feeling your release as your palms draw towards your knees. And then come back to your neutral spine. So just checking in, again, palms underneath shoulders, knees underneath hips, length through your spine to the crown of your head. Right knee stays down, extend your left leg out behind you, lift and lift. So just doing a little bit of work here, getting your glutes involved. I want you to imagine someone is pulling on your foot and lengthening your leg out as much as possible. And feel the work happening where your hamstring and glute meet. So really find that you can exhale, lift your pelvic floor, drawing your belly up and lengthening out through your leg as you lift. Controlling from your center for 3, 2, last one. Now lift to the side and tap, lift back to the center. Lift to the side and tap, lift back to the center. So just imagine you're drawing a bit of a circle or arch shape in the sky as you do this, like you're trying to draw a rainbow, and then tap your toes down. 3, 2, last one. Now from the center, bend, extend. Setting up or checking in the setup of your pelvis and your spine, like it's almost like you have a glass of water on your back that you don't want to have spill. So as you get fatigued, you may notice that you kind of compensate somewhere in your pelvis or your shoulder blades, your thoracic spine, but really checking in and trying not to let that take over. Be really mindful of micro changes your body makes. 3 more here. 2. Last one. Now hold it bent, flex your foot, press up, up, up. Last part here. Stay really connected, stay in your mind. Don't let yourself start to switch off. Be mindful of your body. Ask it for the work. Last 3, 2, last one. Excellent job. Well done. Bring yourself down and come over onto your right side. So we're going to continue to be doing work on the same leg. Come down, head in your hand, and set yourself up so that your knees are at 90 degrees. Check in for your neutral pelvis. So find that work coming from underneath here. Ribs are together, core is engaged. Leave your legs at 90 degrees, lifting up your top leg to parallel with the floor, and then press it back, pull it forward. Now I'm just going to come slightly forward here so I don't hit the wall behind me, because we want you to be able to go back and bring your thigh in line with the rest of your body, the length of your body, and then coming back. So a little bit of work here for stabilization from your center. And really, again, feeling that work where your hamstring and glute meet. So get your pelvic floor involved. Exhale, drawing your belly in, lifting your pelvic floor as you move you through the movement. There are always things in Pilates that we get to practice, work on, challenge ourselves with. The beauty of Pilates is that it's never done. I work on things all the time. And it doesn't matter where you are or where you start from, because we're all always working on things. 3 more here. 2. Last one. Now with your legs back to parallel, internal rotation, knees together, press up. So again, check in here with your pelvis. We don't want any forward rotation or tilting of your pelvis. Keeping it neutral, you're just now on your side. And now this internal rotation is your femur that is internally rotated in your hip socket. 3 more here. 2. Last one. Now pressing it down, bring your legs back so that your heels are in line with your butt. Draw your belly in, checking for your core, opening and closing. Now your heels are going to stay together, and I want you to press them together. Don't let them just kind of be touching there. Really imagine you're trying to squeeze them as much as you can and get that work all the way up the back chain. You showed up today. You did the hardest part of being here and committing to this. So don't let yourself just go halfway. You know that you can do more. Stay in it. Believe in yourself, because I believe in you. 3 more. 2. Last one. Now, knees together, heels together, knees together, heels together. So going back to a little bit of that internal rotation, external rotation. Really good here for your hip mobility. Checking in again with your center. This is the last part of the sequence. Stay strong. 3, 2, last one. Excellent job. Well then, give that glute a little pound out, and then bring yourself up. We're gonna come around to do the 4-point kneeling on the other side. So set yourself up here. This time we're going with your right leg. Palms line up underneath your shoulders, knees line up underneath your hips. I'm just gonna move forward a little bit so I don't kick anything behind me. And then from there, lengthen out your right leg. Lift, lift, lift. So get curious here about the work that is happening and where it is happening. So if you're just kind of here kicking up and down, really try to zone in and zoom right in on the muscles that you're asking to work. Can you really pick up your belly button? Can you find that cinching of your waist like we started with at the beginning? Your ribs together, shoulder blades coming together and shoulders stabilized. Lengthening out through the crown of your head. Lifting now to the side and behind. Lift, side, and behind. Pilates is a practice of asking the best from ourselves when we may or may not think that we are capable of giving it. Because we are capable. And you just sometimes have to ask for it and remind your brain that you're capable of it. 3 more here. 2. Last one. Now from the center, bend, extend. Pressing it out completely straight, lengthening out your leg. Remember how strong you are. Believing in yourself. 3 more here. 2. Last one. Now hold it, bend, flex your foot, press, press, press. Go into that place of discomfort that we talked about at the beginning. Get comfortable with being uncomfortable. Pushing to that little edge of where you thought you couldn't go, and then you go there. 5, 4, 3, 2, last one. Now come on down onto your left side this time. Head into your hand. Find your neutral pelvis, stabilize center. Legs are bent at 90 degrees. Lift your top leg up, flexing your foot, pressing back, pulling forward. Now if you find this is a little bit tricky, you can take your hand down here to support yourself for your balance. But really try to think about getting that from your center. So our core is actually really important in helping us maintain balance in our body. And when you think about it, when you're walking and upright, it is what is helping you stay upright. If you didn't have this big, strong muscle right through your center, or a set of muscles right through your center, then we would just crumple to a ball on the floor. So in essence, our core is always working, of course, but in Pilates, we get to train it to be more efficient. We get to train it to help us more, like when we're in pain. And we get to tell it when to turn on and how, and help it turn on and be active and an agency in turning it on. 3, 2, last one. Now from the top, internal rotation, press up and lower. Again, check in with your center. Exhale as you press up. Find that you're continuing to get that work. Pelvic floor lifts, ribs come together. Get hands on, go through the scan. Don't let yourself switch off. 3 more here. 2. Last one. And then bring them back down. Float your legs back so that now your heels are in line with your butt, in line with the back edge of your mat. Neutral pelvis, heels pressed together, open and close. It's kind of exciting in Pilates to find things that you can work on in practice, because you get to then watch yourself make progress. And when you do Pilates regularly, you will see progress very quickly. And it's very rewarding. So well done on showing up and being here today to practice that and to make that progress. 3 more here. Stay connected to your center. Continue with your breath. Last 2. Last one. Now, knees together, heels together. Knees together, heels together. Again, a little bit of that rotation of your femur and your hip socket. Working on our hip mobility, because we often just have our femur oriented in one position. Find that work from internally. Those deep abdominal muscles working hard. 3 more. 2. Last one. Excellent job. Bring it down, roll over right onto your back. And take your right leg there and cross it over. Give that glute a little bit of a reprieve. Stretch. And we're going to do the same thing on the other side, just crossing the left over. So now we've spent some time on your glutes, getting your butt all warmed up, and now we're going to spend some time on your rectus abdominis. So that's the 6-pack front muscles, and they are the prime movers when we do anything like head lifts. So we're going to start with that now. Leave your heels together or on the floor and your feet together, legs together, hands behind to support your neck. Exhale, draw your belly in, upper abdominal lift, and lower. So I want you to just start to get warmed up here through your rectus abdominis, because we have not really worked it very much today. And even though we are working that front part and bringing it and crunching it up together, you still need the stability from your other abdominal muscles that we set up at the very beginning. So exhale, feel your waist narrow, ribs come together, belly button comes in, and then lowering down. Imagine you're trying to peel your shoulder blades up off the mat from behind you. And start to try to feel this warmth that's being generated in your tummy muscles. It might not necessarily be that your abs are really sore from doing this, because it is just the foundational level. And if they are sore, totally fine. But you might just notice, it's warming up inside there. So if you're warming up and you want to take it to the next level, come with me to your single leg extension. Starting from the floor, exhale, lift one leg up, other leg up into tabletop. Continue on with your upper abdominal lifts. So this is part 1, or the first stage, I should say. I'm going to progress us through several stages, and you can always regress and go back to this previous stage. We're going to go now into a single leg extension. So you're coming up, pulling on one leg, extending out the other. arm to give you a little bit of extra height. Each time you exhale, feel that you're coming through that deepening of your belly. Lifting your pelvic floor. 3, 2, last one. And then hug your knees in, bring yourself down. You can just gently rock from side to side. And then bring your feet back down. You're going to have them slightly apart this time. Take the heels of your hands to your ASIS bones, those little bony landmarks on either side, and then take your fingers to form a triangle and place them on your pubic bone. Now I just want to do a little bit of pelvic mobility here. So posterior tilt your pelvis, that's where you imprint your spine on the mat underneath. And then anterior tilt, coming in the other direction. So just a little bit of a movement to check in with your pelvis, where we spend most of our Pilates class in a neutral pelvis, but it's important for you to have this mobility. And the reason that I've had you form your triangle here is so that you can really see the dips up and down. And when you do that, then you get to really also experience that sensation in your body of moving your pelvis inside. So it's sometimes a little bit hard to conceptualize because it's not like your arm where you can see it moving. It's inside, obviously. And so this triangle is your feedback of the movement. Now come to your neutral pelvis. Leave your triangle parallel to the ceiling. Hands come back behind to support your neck. And then leave your left foot on the floor, right leg lifts up to tabletop. Exhale, upper abdominal lift and lower. So keeping that neutral pelvis the whole time. Narrowing at your waist, drawing your belly in, lifting your pelvic floor. Stay as you are, or next time you come up, arms extend out, coming back, coming down. Use your breath here to help you when you extend your arms out. Use them as that little bit of extra lift to help you come off the floor. Three more here. Last two. Last one. Now bring your hands back and then take your outside hand to the outside of your knee. Press into your knee and you press your hand into your knee and your knee into your hand. Stay up. Exhaling, draw your belly in. So just doing a little bit of an isometric hold here. Keep pressing and resisting between your hand and your knee. Core is engaged. Strong work. Lift your pelvic floor. Stay up. 3, 2, last one. Excellent. Bring it down. Feet come back down, both on the mat. Hands come down by your sides. Now we're going to do a little bit of work into your pelvic bridge. So for this, I want you to articulate through your spine, and you start that by posterior tilting your pelvis. So imprint your spine down to the mat. Exhaling, drawing your belly in, peeling yourself up. Reaching the top, ribs are together, and then articulating your way back down. Continue on in this at your own pace. Exhale, posterior tilt, imprint your spine. Sticking yourself back down. Feel on your exhale how you draw your belly in, round through your spine underneath. Try to feel each vertebrae peel off. And then from the top, each vertebrae stick down like you are a sticker. Exhale, coming through again, posterior tilting. And you can continue doing it as we are, or this time you can stay up and going through your marching. So one leg lifts, lowers, other leg lifts, lowers. Checking in that your pelvis stays in the same spot. So be mindful of one side wanting to tip down as you shift your weight over to just one leg. And really press your heel into the mat and have this sensation of drawing your heel towards your sits bone. Shoulders are relaxed, ribs are together, core is working. One more on either side. And then from the top, articulating your way back down. Very good. Hug your knees in. Just have a little pause there for a second. And then I want you to take your heels and press them together and form your Pilates V. And then take the backs of your heels and place them onto the mat. So you're now going to have external rotation of your knee, of your femurs and your hip sockets. So your legs are going to be going out to the sides with your heels pressing into the mat. Now before we go anywhere and do any movement, I want you to find a neutral pelvis. Keep that. Press your heels into the mat and then have the sensation that you're pulling them towards your sits bones. And then release. Press in and pull. And you should pretty quickly find that you're able to fire up your hamstrings doing that. So inhale to prepare. Exhale, press and pull. Get that work from your pelvic floor. So it's like your center here is coming together to draw your heels in towards your sits bones. And your hamstring connection to your glutes and your pelvic floor is really important when we talk about activating your deep core. Now you can stay there, or for the next level, you leave your pelvis neutral. So we're not articulating this time. You leave your pelvis neutral, press down, get that sensation of pulling in, and then lift your butt up off the mat. Imprint it or press it back down. Heels press down, sensation of pulling in, lift your butt off, glutes work, glute squeeze, sit it back down. So you should feel when you come up that you are squeezing right where your hamstring and glutes meet, almost like you're trying to squeeze something right in that little fold, and then release. Strong work. Try not to let your shoulders start to elevate or lift off. Leave them completely undisturbed underneath of you on the mat. Really good work here for your hip extension, for your pelvis, for your hip mobility. If you're a runner or an athlete, this is a really great one to keep those glutes activated with your hip extension. 2 more. Last one. Excellent job. Hug your knees in, gently rocking from side to side. And then take your feet back down to the mat. Lift your left leg up into your tabletop. Hands come behind to support your neck. Exhale, upper abdominal lift and lower. So again, do that little scan. Find or check in that you have your neutral pelvis. And then each time you come up, belly button deepens, ribs come together, pelvic floor lifts, narrowing at your waist. Lots of things to focus in on. Add your arms if it's not too much. Using them for that little bit of extra lift. Hopefully you're now really feeling that strong fire in your belly. And check in if there's something that you can relax. Somewhere that you're holding tension that you don't need to be. Hold up on your next one. Left hand comes to the outside of your knee. Exhale as you press your knee into your hand, hand into your knee. Holding yourself up. Draw your belly in. Keep feeling that resistance. Strong through your core. Keep breathing. 3, 2, last one. Yes, well done. Rolling yourself down. Hugging your knees in again, just gently rocking from side to side. So much great work here. And then reach your arms up overhead, lengthen out through your legs. Push your fingertips and your toes as far away from each other as possible and feel that amazing stretch all the way through your body. And then check to make sure that your feet are down at the end of your mat. And we're going to come through your roll up. So your arms start up overhead. Inhale to prepare. And then exhale, tuck your chin towards your chest. Drawing your belly in, peeling yourself up one vertebrae at a time. Coming up, reaching forward. And then imprinting yourself back down. Now these can be a little bit sticky at the beginning, even for me. So be gentle with yourself. Don't be frustrated if it takes you a couple to get into it, as you can see from me today. And of course, if you need to offer yourself assistance, as you come down, you can put your hands down. And as you come up, you can bend your knees and grab behind your hamstrings to offer yourself a little bit of help. So whatever version you're choosing, we're going to come through 2 more. Exhale to bring yourself down. And then inhale at the bottom and exhale to bring yourself up. Reaching through. At the end of your second one, finish in your seated position. And then pick up your magic circle. Take your circle and place it just on your sternum and have it out in front, and I want you to imitate the shape of the circle with your arms. So really have your arms like in a rounded position with your fingertips at the front together. Knees are bent, feet flat on the floor. Inhale to prepare, exhale as you come straight back and then come back up. So you can have a little bit of pressure into the circle onto your sternum. And it's here to help you keep that length of your spine as you come back and return to the center. Now, if this is too much on your neck or your back, then you can get rid of the circle and do it without, or you can come through around it. So you can tuck your tailbone underneath and come through like this here. It is stronger to maintain that long neutral spine. So challenge yourself, if it's available to you, to do that. Now from the top, coming down, rotating to the side, back to the center, rotate to the other side. So just using the circle now to facilitate some spinal rotation. Exhaling as you rotate. Inhaling back at the center. Use the circle to help you. So it's there to help maintain that length of your spine, to help the work continue to happen in your thoracic, like we had at the very beginning of class. One more on either side. And then you can place your circle down. Bring yourself around so that you have your feet and legs to the right side, or to the left side, sorry. And then take your circle and put it out to your right side. So it's going to be the opposite side of your feet. You have the handle on the floor and then the handle underneath your hand. Exhale as you fold over and press into the circle. And then bring yourself back up. So we're of course doing a variation here of mermaid. If it is too much for you to have the circle, simply bring your forearm down and do it without. Having the circle there requires you to have some more stability through your shoulder and really challenges the work of lateral flexion. So as you fold over, exhale, narrowing at your waist, draw your belly in. I'm pressing into the circle, stabilizing from my shoulder behind. Exhale, coming across. Feel the folding of your waist. This is strong work. One more. Now leave your legs where they are. Flip the circle over to the other side. Now for this one, your arm is going to end up bent, your circle arm. Same thing. Exhale, folding over, press into the circle. Pressing your top fingers across. And then release. So the circle there, your circle is there to really get you involved in your body. You have to make more things work and coordinate together with the circle involved. One more here. Very good. Then bring yourself to your legs lengthened out straight in front of you. I'm doing it this way so you can see a little better. Take the circle out in front, holding on to the handles. Palms are going to press in as you exhale and flex, and then come back up straight. So start with your lengthened spine. Exhale, flexing through your spine, drawing your belly in, squeezing the circle, and release. So there will be a slight coming forward, but not hinging at your hips. So we're using the circle again to facilitate that drawing in of your belly, drawing in of your ribs. One more here. Rounded spine. And then releasing. Bringing your feet and legs to the left side, or right side, sorry. Circle is going to start over on the left. This is the one with your arm extended out. Sitting yourself up tall. Exhale, pressing into the circle, pressing across. Might take a couple times or the first time to get your circle oriented. Mine, for example, was a little bit too close. I'm going to move it a little further so that when I flex over and fold, I can press pretty much straight down into it. Inhale at the top, exhale. Lateral flexion here. Really trying to narrow at your waist, draw your belly in as you press across. Last one on this side. And then releasing from there, switching it over. Circle is gonna be placed on the floor and your arm is gonna stay bent. Same thing, start with yourself up tall and then press your hand over as you press down to the circle, folding across. Releasing back down. Inhale at the top, exhale. Really thinking about trying to draw your belly in, folding right here at your waist. One more here. Sitting up tall, and then exhale, coming across. And then release from there. Take your circle, place it on the floor. Take that right leg and bring it all the way around across over your left. And then rotate and shift your gaze around so you're trying to look over your right shoulder. Just feeling this lovely rotation in your spine. And then coming back to the center. Switching over, left leg crosses. Sit yourself up tall and then rotate and twist around towards your left. exhale, and then return back to the center. Bring yourself to a comfortable seated position. Feeling as you inhale and exhale, filling yourself up with breath. Inhale, arms come up overhead. Exhaling as you glide them down to land in front of your heart center. Pause there. Give yourself a high five for showing up, for completing the class, for doing the work, for being here, for being in your body, for going to places of discomfort and for staying there. And more than that, for just committing to moving and looking after yourself. Thank you so much for being here with me. Can't wait to see you again.